Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and here are the latest developments from the world of medicine. The safety of COVID vaccines in patients for cardiovascular disease in particular. According to a large study that was published in the Cardiovascular Research, COVID-19 vaccination is not associated with an increased risk of heart attack or stroke in patients who've had a previously established cardiovascular disease. Now, this was the first study to examine the association between COVID-19 vaccines and the risk of major adverse cardiovascular events in patients having an underlying cardiovascular disease condition. Now, the study included a total of over 2 lakh patients with cardiovascular disease, and of which 1,764 were vaccinated and experienced MACE during the study period. It was then found that there was no evidence of an elevated risk of MACE after the first or the second dose of vaccinations. Hence, the authors concluded that pre-existing cardiovascular disease should not prevent people from getting vaccinated against COVID-19, and that vaccination is particularly important for this group since cardiovascular disease is associated with worse outcomes and a higher risk of death after COVID-19 infection. A new sensor that helps detect a potential concussion. A newly developed sensor patch worn on the back of the neck may be considered to be helpful in predicting the risk of concussion in high-impact sports such as in American football or judo. Now, the study is published in the Scientific Reports. It reports that the small and flexible device is able to detect a sudden neck strain such as a whiplash. The researchers developed a novel patch sensor using a thin film layer of thermoplastic material that produces the electrical energy when physically touched or pressure is applied on it. The electrical signal produced is proportional to the physical strain on the neck and can be even used to estimate the acceleration and the velocity of sudden neck movements, which are basically considered as the two most important markers for predicting a concussion. Now, to test the sensor patch, the authors applied the device to the back of the neck of a dummy that had an accelerator-based sensor and a gyroscope both inside the head. They then dropped the dummy from a suspended height of 61 centimeters to simulate a whiplash and found that the sensor patch output had a strong positive correlation of 90% with results from the sensors inside the head. Therefore, the authors concluded that their device can potentially be used to measure a whiplash and also could help detect concussion. Particular environmental hazards that are responsible for increased risk of cardiovascular death. A recent study quantifies that cardiovascular risk posed by an exposure to specific environmental factors. Now, for example, the air pollution, it heightens the risk of heart disease mortality by 17%. The research that is published in PLOS One journal is the first to examine the impact of multiple environmental risk factors on the cardiovascular mortality and may even lead to increased patient screening and preventive measures to improve chances of survival. The study, which is known as the Golestan cohort study. Why is it called so? Because the participants were from the Golestan province, a lower income, multi-ethnic and mostly a rural area where cardiovascular disease is the leading cause of death. The investigators used environmental data to create maps of 8 environmental risk factors across the province. These maps included an ambient fine particulate matter air pollution, how households cooked, heated and ventilated their homes, how close they lived to traffic, their proximity to hospitals that perform percutaneous coronary intervention procedures, neighborhood socioeconomics, pollution, density, etc. Now, they found those exposed to the highest levels of outdoor air pollution were 17% more likely to die from heart disease compared to those who were unexposed, and 20% more likely to experience an all-cause mortality. Participants exposed to indoor burning of wood, dung or other biomaterials without any ventilation were 36% more likely to die from heart disease and 23% more likely to experience all-cause mortality. Now, people that were exposed to indoor kerosene burning without any ventilation were 19% more likely to die from heart disease and 9% more likely to die from all-cause mortality. For every 6 miles participants lived away from a catheterization lab, the risk of cardiovascular death went up by 2% and all-cause mortality by 1%. Now, living within roughly about 0.06 miles of a small roadway and 0.25 miles from a large highway were associated with a 13% increased risk of all-cause mortality. Now, researchers therefore concluded that their work did demonstrate how publicly available data can be used to create risk maps for individual communities, even in rural or low-income settings. Eventually, they also expect health systems to use similar approaches to create environmental risk maps. An increase in the headaches among children amidst the pandemic. Prolonged exposure time to computer screens, a lack of suitable condition for online learning from home, school exams, and anxieties about COVID-19 were all found to be a risk factor for the worsening of headache symptoms or triggering new onset headaches. A new multi-center study analyzed 851 adolescents aged between 10 and 18, with 89% of children reporting headaches over the study period. Among these children, 10% reported new onset headaches over the pandemic homeschooling period. 27% of the children said their headaches had worsened, 61% said their headaches had remained stable, and 3% said that their headaches had improved. The ones who reported worsened or new onset headaches suffered from headaches an average of 8 to 9 times per month. The study found that headaches had a big impact on the mental health and school achievements. Depression and anxiety scores, including the anxiety about catching COVID-19, were significantly higher in the worsened and the new onset headache groups. These respondents also acknowledged the fact that they had made less effort with their schoolwork and their academic achievements had also fallen. Exams, living in a city, weight gain, and depression were all linked to more frequent headache occurrences within the study. Although earlier studies reported that young people were having fewer headaches due to the closure of schools in the early weeks and months of COVID-19, this long-term study has found the stresses and pressures of the pandemic eventually took their toll. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.